So, hello everybody. On behalf of Soka University Faculty of Nursing, I feel so much appreciation towards you to invite us for such a profound collaboration for the sake of nursing and for the people who receive nursing. My name is Yumi Oshida. I work for Soka University Faculty of Nursing, and today we'd like to present preliminary analysis of Japan using the profile of caring just recently. So before I start talking about the result, let me introduce Soka University. Soka University is a private university established in 1971 in the city of Hachioji, about 40 kilometers from the metropolitan Tokyo. And we have 8 undergraduate faculties, and nursing is one of the faculties. And approximately 7,230 students, undergraduate students, and 400 international students registered in 2021. And actually, we are really known that one of the top global universities in Japan. And we had MOU between the University of Bible. So that's how we met, and Dominica and then us. So we were introduced to the collaboration. And the Faculty of Nursing was established in 2013 as undergraduate program, and approximately 80 students per year. And the total of 300 some students are at the Faculty of Nursing currently. And development of nursing professionals as a global citizen who practice value creation is our aim. So it means capacity to find meaning to enhance one's existence and contribute to the well-being of others under any circumstances. So that's our focus. So a little background of the research. I'm going to talk about Japanese nursing. We are facing super aging society, demanding the nurses very high, and about 10.7 million healthcare worker is projected to be necessary. So nurses are really having a hard time after, facing a COVID-19 pandemics. And we are really happy to explore the nurses' job satisfaction scientifically and comprehensively so that we can contribute to lower the turnover rate. And actually, historically or in the past, the Japanese nurses are really known to be hard worker, hard work overtime extensively, and have less autonomous practice and change job frequently, especially newer, nurses, and work less flexibility and rarely call in sick, actually, very hard worker. So from now, Satoshi is going to take over. He's a Dean of Faculty of Nursing.
Yes. Good afternoon again. I'm really honored and I'm really grateful to be here and joining the professional teams. And unfortunately, we have to leave tomorrow. We wish we could stay longer, but I really apologize. So we have conducted this profile of caring Japanese version. This is the first research survey in Japan. Actually, we have been really looking for the survey which can measure the job satisfaction of nurses. And we really happy to know this profile of caring is really good scale to work at. And I personally thank Nika to introduce this survey, and thanks to John Nelson. So the survey was conducted at a public hospital with a 485 bed capacity. Period of data collection was just we finished collection of the data from July 26 to August 25. Originally, the period is 2 weeks data collection, but looking at the responder rate, we extended to 2 more weeks. So in total, 4 weeks. Out of the total of 504 nursing staff, 303 responded, representing a 60% response rate. So this is because nursing manager she is really interested in this scale, and she is really enthusiastic to introduce this scale to her hospital. So she really promotes to nursing staff to respond to this questionnaire. So that's the reason that we have really high response rate. Now, among 303 who responded to the survey, 226 completed all 35 items, so representing 74.5 completion rate. So I just briefly show the demographics. So age, which range from 21 years to 65 years old. So 65 is a retirement age of Japan. So basically, it's not unusual to work over 65 years old. So mean of the age is around 40. The years on same word is mean like roughly 6 years. And years in same professional. This survey this time we only focus on nurse. So this is years in working as a nursing profession is 16, roughly 17 years. Then hours worked per week is 40 hours per week, but it might not including the overtime. So basically, in clinical setting, nurses have to work more than I think it is described here. And some more is gender. Female is majority, 86.8%, and marital status is married is 46.5%, and single is 36.6%. The level of education is mainly the nurses completed vocational school. That is 3 years vocational school. And after 3 years this school's education, they can take national licensure exam. After passing the exam, they can be registered nurses. Then complete the bachelor's degree is only 21%. So, but I think this percentage will be increasing from now on because our Japanese government introduced the new law to promote nurses has to complete the 4-year bachelor degrees in 1993. So now, during the 30 years since the government promoted, now in Japan, more than 250 nursing school was established since that time. Then, most of the respondent is registered nurses. Then psychometric testing, thanks to Dr. John Nelson, he gave us this analysis report. I just quoted from the report. Cronbach alpha revealed good reliability for all subscale. All of the subscale except the clarity subscale were above 80s. So clarity has an alpha, Cronbach alpha only 0.74. Then explanatory factor analysis was also conducted, all the 35 items. And then KMO indicator was 0.934. That means that we have enough size of the sampling. Then factor loading were above 0.40. All items except item in the clarity subscale and the autonomy subscale. So clarity loaded very weakly with autonomy. Then 7 factors, total of 35 items, which can explain 67.8% of the variance. This is the most, it is quite small. I'm sorry for that. We have 7 loading factors, and then here autonomy and clarity, and here it's quite low loading factors, so they cannot be included these 7 factors. So clarity, I think it's also similar to other countries. So during the COVID pandemic, nurse had to face the situation. So some nurses sick due to the COVID, they have to suddenly change their task assignment or assign to move to COVID-19 world. So it's quite flexible, and suddenly they change their assignment and role. I think that might influence the result. I think that can be discussed later on more detailed, but I guess this is one of the reasons. And the autonomy is also a low acting loading role, because nurses in Japan is compared to other countries less autonomous. So fortunately, still they have to follow the order of the medical doctors and then also the senior nurses. So that might also one of the reasons. So and next. So descriptive statistics of all subscales. Here, the highest subscale score is satisfaction with poor workers, which means which are the means of a 5.1 score. Then, as shown here, and then compared to all other countries, including Japan. So compared to this score of subscale of Japan, surprisingly, we found that except satisfaction with organizational reward, all the subscale score lower than all countries, subscale of all countries. So I found it's quite lots of places we have to tackle, and we have to do some intervention to level up the satisfaction of the nurses. It is really urgent need for our nurses. Only satisfaction with organizational reward is similar to other all countries. The reason is Japanese nurses are quite underestimated their performance or their satisfaction. It might be one of the reasons. And of course, the reality is that, as the figure shows, satisfaction is lower than other countries. And regression analysis of outcome variable. First, demographics. I just picked some items which are statistically significant. So profile of caring, so age and years in same profession. I think age and years in same profession correlate. So higher age is more years in same profession. So it shows that as age increased, well-being as measured by the profile caring decreased. So as longer they work, unfortunately, as lower they provide a score of the profile caring. In 10 to 6 days, there's no any demographic items which are statistically significant. Intent to leave, so age and years in same profession. So that also correlates the profile of caring. So as long as they work, they feel more intent to leave. So pandemic difficult. So we don't have any demographic items, which is statistically significant. But pandemic still negatively affects education and position are statistically significant. Pandemic still negatively affect them. So, for example, the education, a bachelor degree holder have more resilient trauma than vocational graduate. And also position, those who are in leadership have more resilient trauma when compared to the staff. I think the nurses with higher education has more responsibility and has to have a more strong leadership that face some difficulties, and that causes the pandemic still negatively affects them. So next is subscales. So intent to leave. All the subscales are related to intent to leave. Satisfaction with co-workers, satisfaction with autonomy, satisfaction with organizational reward, and other subscales are related to intent to live. We found this is quite important findings to us. So we really have a lot of things to tackle and to increase their satisfaction in order to avoid retention, in order to avoid that situation where nurses want to leave their job or their working places. And the pandemic was very difficult, and the pandemic still negatively affect me is related to satisfaction with organization reward, and then clarity of role and systems. So these are the findings of regression analysis. Then, as in conclusion, so there are high demand and interest from hospitals and management level agreement of cooperation. As I said, as we conducted this survey, nurse manager is really interested in this scale, and she hope she can do it every year and to monitor their intervention, whether their intervention can work out or not. So it's really high demand and their interest. And to understand the operation of care scientifically and use the data to improve the experience and the outcome for both patient and staff was important to them. So low subscale compared to the average all countries, as I explained, and intent to leave of the nurses in Japan was inferior to the related to all subscales. So important suggestion for future effort was found in nurses satisfaction, support from management, and self-care to improve their intention rate. So that's all. Thank you very much.